Hi, everyone. I'm Elaine Petrucci. I am so excited to be back in touch with all of you and being live on camera again after my fall. So I would like to introduce the compassion for caregivers today and the need for more resources because of the lack of resources available to caregivers, whether they are a family member, a paid caregiver, or if you are working at a hospital or a clinic or an assisted independent living or memory care unit. So please join me and let's get started. I will be talking about compassion in caregiving and tips to create a more supportive environment for caregivers and providing those resources that you need when you're caring for others. First, I like to share some statistics with you. By 2030, 72.8 million Americans, more than 1 in 5, will be 65 or older. This statistic is overwhelming to me because that means that 45% of the US workforce will be retiring in 7 years. And where will we be getting the caregivers who the most senior of seniors require? There is the greatest growth among the old, who are typically most in need of help. And that number in that group, those in their 80s and above, will soar from 27% in 2012 to 37% in 2050. There are 44 million unpaid elder caregivers in the United States. And that really means a family caregiver who is also raising a family, working full-time, and caring for a parent or grandparent. And 75% of them work other jobs. There is greater financial stress and challenges in balancing work and family. And of those who work, only 53% say their employers know about their additional caregiving responsibilities. And this statistic also worries me in the sense that caregivers and employers really need to begin to understand the financial hardships of working adults in the sandwich generation. Again, close to 70% of working caregivers adjust their work schedules to accommodate caregiving responsibilities, which means taking time off work, retiring early, quitting, or turning down job promotions. Forces some to set aside their own ambitions and their career opportunities, as well as their retirement spending. Again, significantly impacts their financial situation. And presenteeism may cost employers even more than absenteeism. And presenteeism is really having someone at work, but however, they are not fully there because they're thinking about their other responsibilities of caregiving. The average working caregiver misses about 6.5 days per year. And over a lifetime, employees who leave the workforce to care for a parent or a family member lose close to $300,000 in wages and benefits. And this loss is even higher for women. Working caregivers who live paycheck to paycheck are often hit hardest by the financial strain of out-of-pocket long-term care costs because they don't have the financial resources to set aside money for long-term care insurance or other insurance products that would allow them to be paid, or for the services to be paid for the person they're caring for. And many are low-income women of color caring for a parent or a family member, needing daily hands-on assistance for tasks like bathing or dressing. Well, 41% of caregivers say that they experienced no financial strain from caregiving. 18% say they endured high financial strain. And those between 18 and 49 years old experienced the highest strain, likely due to reduced savings, higher debt, and trouble controlling expenses. So now let's look at aging boomers and family caregivers. Healthcare and social service systems have not adequately prepared for the demographic shift that will affect so many older adults and their caregivers. Again, like I said earlier, 45% of our US workforce will be retiring in 7 years, and there will be a reduced number of family caregivers as well as paid caregivers to take care of the seniors. Today's caregivers are often marginalized, they're left out of treatment decisions, and are untrained for complicated tasks, for example, wound care. Yet they are assumed to be available for a broad range of duties. Caregivers comprise an invisible workforce that provides vital support to a growing number of individuals suffering from physical, psychological, and neurological complications. Unpaid caregivers tend to be family members who care for their relatives out of love or because they cannot afford to hire help. If this work were to be replaced with paid services, it would cost an estimated $470 billion annually. Yes, it's really outstanding that only 13% of caregivers say anyone has ever inquired about what they need. And that is really mind-blowing to me. So let's now focus on how you can help others, especially those family members or any caregiver who believes that they are invisible, they're not seen or heard, and need support more than what society offers. Everyone needs the occasional reminder that they are not alone. Often, caregivers may not even realize the extent of their stress and burnout until it's too late. That's when 30% of caregivers die before the one that they're caring for. Just listening without judgment provides caregivers with valuable outlet to vent their frustrations, anger, guilt, and hopelessness. It doesn't take much to check in on a caregiver while treating patients. If it's clear a caregiver needs more help, offer to connect them with a mental health clinician. Often caregivers just need accessing the right resources and information to make them feel like they're being seen, that they're being heard, and now they have the information that they need to better care for their loved one. Navigating insurance and the healthcare system can be daunting and vary in what they will and will not cover for caregiver support. Discuss this with caregivers and offer resources that you can give them clearly and with accessibility. Now let's turn our attention to national help. The Recognize, Assist, Include, Support, and Engage Family Caregivers Act seeks to establish a national caregiving agenda to improve coordination across various government programs to assist caregivers and recipients. The Credit for Caring Act helps offset the expenses of caregiving. For the 2021 tax year, you could claim a portion of up to $8,000 in caregiving costs for one person and up to $16,000 for 2 or more individuals. The Family and Medical Insurance Leave Act is another piece of legislation currently in Congress and seeks to create an insurance fund to provide workers with a portion of their wages for up to 12 weeks a year while they seek care for their own health needs or to provide care for a family member. Let's now look at technology help. While limited, technology has provided useful benefits to about 53% of caregivers, although it generally depends on the age and comfortability about using it. Most use software to help track a recipient's finances and personal health records. And only 17% use apps, video, or wearable devices to track a recipient's whereabouts and safety. This also needs to be changed with more awareness that wearable devices are really critical in providing the appropriate health and safety for the person receiving care. I would like to offer 7 tips to create a more supportive environment for yourself and for others. Let's first start with mindfulness, a state of mind that focuses on the present moment without judgment or distraction. It can help increase concentration and reduce mistakes, support better self-care, and reduce stress and anxiety in both caregivers and their recipients. Mindfulness also allows the caregiver to better be able to identify and manage levels of psychological stress. It's less likely to use physical restraints and stat medications with patients who become agitated. And there's significant reduction in aggressive behavior. The second tip is gratitude. Make an effort to recognize even the smallest positives that occur for you during the day, which will help you keep things in perspective. An easy daily practice could involve quickly jotting down a few things that you're grateful for. Gratitude is also a good release and a good reminder for later. during more challenging times. My third tip is to build resilience. Resilience is the ability to recover quickly from stressful situations. Resilience can be strengthened through a mindset that keeps things in perspective, uses humor to diffuse difficult situations. It focuses on compassion and positivity, and it engages in meaningful activities and the present moment so that you can be in the moment with the person that you're caring for, so that both the recipient and you get the most benefit from those interactions. A caregiver also needs to have positive psychology. Positive psychology is the scientific study of what makes life worth living, which was established in 1998 by Dr. Martin Seligman. He focused it on positive emotions, behaviors, and character strengths. Positive psychology mitigates the effects of burnout among healthcare providers and caregivers. It's that analogy: put on your own oxygen mask first before you can help others. Positive psychology can also encourage and empower you to ask for help and advocate for the care recipient's needs. The fifth tip is don't suffer in silence. Ask your employer about benefits such as backup care and resource and referral programs. Ask if there are workplace policies such as flex time so you can adjust your schedule and spend more time caring for your loved one if needed. If you need extended time off, ask about the company family medical leave policy. A note here is that companies with 50+ employees are legally obligated to allow employees a protective leave of absence to care for children or aging parents. Typically, this is without pay that may save your job. Let's follow the Boy Scout model of being prepared. Learn in advance about payer options, about Medicare, Medicaid, long-term care insurance, veterans benefits, and other insurance models that you can utilize to help you be more prepared if you're in a caregiving situation. Ask your employer if they offer classes or information on elder care topics. You can go to medicare.gov for information about long-term care and how to pay for it. Also talk to elder law attorneys who can provide you with much needed information about estate planning. You can also familiarize yourself with the financial landscape ahead of time, which often results in less confusion and better outcomes for the person receiving care. Finally, have the talk about money. Discussing money is one of those thorny, uncomfortable subjects that adult children and their parents often avoid, often to their detriment. You need to view money as a private matter. It is ingrained in our American culture, particularly for the generation that came of age during World War II. Having candid conversations about money will enable caregivers to chart a pragmatic course based on realistic options, and it will always help you be more prepared should any emergency situation arise, or if there is a change in the health condition of the person who needs care. You can also look for caregiver resources at the Family Caregiver Alliance. You can look for the Family Caregiving Alliance fact sheets, and they can give you information about caregiving with siblings, grief and loss, holding those so important family meetings to discuss the financial, legal, and medical topics that will be really important during caregiving. And you need to be taking care of you. Self-care for family caregivers is so critical. You want to be at your best when caring for someone else. You may also look for caregiver resources at the Elder Care Locator, the National Association of Area Agencies on Aging, the Alzheimer's Association, Lots of Helping Hands, the National Alliance on Mental Health, the Caregiver Action Network, and federal support for caregivers. You can also look for resource guides by state from AARP. You can look for Medicare coverage, Parent to Parent USA. You can also find information and resources at Technology and Apps and the Zen Caregiving Project. I highly recommend that you read Gail Shee's Passages in Caregiving, the Caregiver Help Book, the Emotional Survival Guide for Caregivers. All of these resources are extremely valuable in giving you the information that you need to be the best caregiver that you can be. So I'm asking you if you would like to break those chains of stress, overwhelm, and burnout, and the lack of resources that you have when you are taking care of a family member or someone in your care. How would things be different if you were to experience less stress, be more present with the person you're caring for, stay more centered, be more confident in your caregiving responsibilities, and that you could create more ease and joy for yourself and the person you're caring for? I want you to break those chains so that you can do more, be more, and live more, so that you all can be who you are meant to be, and so that you can live a purpose-filled life, not only for yourself, however, to help the person you're caring for live their best life as well. I will be having additional self-hypnosis masterclasses on April 6th and in early May. I would love to have you contact me by using my Calendly link so that we can talk about your specific situation and how I can best help support you in your caregiving journey. And by using self-hypnosis, you can put yourself in a better frame of mind several times during the day so that you can be your best, no matter what situation is occurring around you. These are different ways for you to connect with me. Please connect with me at mpetrucci2002@gmail.com or find me through the Caregiver Lifeline Academy.com. I'm here to help you in your caregiving journey. I know that I would have given anything to have more resources available to me when I was caring for my mother with Alzheimer's, and then also finding paid caregivers for both my mother and my father. All of that information would have been so gratefully received because it would have made me feel more confident and in control, and that I was doing the best for my parents. I want to thank you for joining me this afternoon. I look forward to serving you. Please reach out any way you can. I am here to help you make this the most rewarding caregiving journey for you and the person you're caring for. Thank you for attending.